You're very welcome to this SOOTHE webinar. It's the second of our webinars, and this webinar is following on from last week's presentation, which spoke about the SOOTHE eQuilt project and presented the SOOTHE eQuilt project to you at the time. So for this session, what we are doing is we're going to talk about the next stage of that, which was where we moved into looking at our interactions with people with intellectual disability, and we started focusing on the things which were important to them in terms of how they understood mental health and well-being, and beyond that, how they what type of things they used and what type of approaches they employed in order to maintain good mental health and well-being. The initial part of that work will be the subject of today's webinar, and then next week we leave you with a cliffhanger at the end of this one, because next week you'll be waiting to find out, well, what did they actually tell us and what did we learn? So today our focus is on how did we do it. So again, everybody, if you've just joined us, you're very welcome. We have a webinar of about 90 minutes today, and we had about 136 people who joined us last week, which was really positive, and we've had a very good feedback since then. In relation to the actual plan for today, I'm going to welcome and introduce my colleagues who are with us today. After that, I'm going to explain the background to and the development of the SOOTHE program. Now, some of you will have heard this small section last week, but I think it's important for those who weren't able to join us last week to understand and to have an opportunity to understand how this fits into the bigger project. And when we get to the end of that, I'm going to hand over to my colleague, Dr. Sandra Fleming, who will lead us through the discussion of the rollout of the interactive sessions at each location, and she will bring in colleagues from Spain and from the Netherlands in that regard. And then they will also talk about the experiences of engaging with people and challenges. And there have been formidable challenges, as we all know, in the last 10 months, which have related to the arrival of a pandemic and the fears and the difficulties that pandemic presented to us. So we'll explore some of those, and I think it's a really interesting time, because we've had to learn how to do things in different ways, and we may have thought before this that our fellow humans with intellectual disability might have difficulty and challenges in using some of the technology. But we found that there was an openness, a flexibility, and a willingness, and we'll explore that more so when we talk about how the virtual meetings were supported. And there's some really innovative work which was used there, and I think you'll find that very interesting. And then we're going to come to the end of this webinar around 11 o'clock, where I want to talk about the potential for replicating the SOOTHE program in other sites and countries, and to sort of lay the grounding for that to happen as we move forward. And there will be time for questions and answers as we go through this. In relation to questions and answers, you will see on your screen in the Zoom toolbar a Q&A facility. So please ask questions in there. If you type the question in there, what we'll do is towards the end of this webinar, we will have time to try and address as many, if not all, of those questions as we can. The other thing to note, if you're a social media user, particularly Twitter, I would ask you, if it's all possible, to tweet about this webinar. If you find something interesting has been said, please, and I hope there is a lot of things that are interesting, please tweet that on to others and use the hashtag SOOTHEQuilt. SOOTHEQuilt. So I'm going to move to the introductions. And I have a screen which has the images of some of the people who will be with us today. You've heard from me, but I'm going to ask Sandra to introduce herself very briefly, first of all.
Thank you very much, Fintan, and good morning, everybody. My name is Sandra Fleming. I'm a registered nurse in intellectual disability and lecturing here in the School of Nursing and Midwifery in Trinity College. And I was part of the Irish team, particularly working with my colleague, Dr. Eddie McCann, and then my two colleagues from Learnovate, Frank and Pablo.
Thank you, Sandra. And Jose, would you like to introduce yourself briefly?
Yes. Buenos días a todos, mi nombre es José Durán, soy terapeuta ocupacional en el Parc Sanitario Sant Joan de Déu de Barcelona y bueno, contestando un poco a una pregunta que hemos visto de Bea, el seminario se hará en varios idiomas y sí que nuestra parte será en castellano, ¿vale? Entonces así todos podéis entenderlo, ¿vale? Muchas gracias. Fintan.
Gracias. And Desiree, would you like to introduce yourself, please?
Bueno, como decía mi compañero, nosotros sí que hablaremos en inglés, en español y haremos una breve síntesis en inglés, nada más.
Okay, gracias, thank you. Walter, can you introduce yourself briefly?
Yes, thank you. I will do it very briefly in Dutch and in English as well. Ik ben Walter Paans, werk aan de Hans Hogeschool en werk daar samen aan het SOOTHE-project met Maud Bonen en Judith Pelikaan, die hier allebei ook aanwezig zijn en over het project in Nederland zullen vertellen. My name is Walter Paans. I am a professor at the Hans University of Applied Science, and I will introduce you also to Maud Bonen and Judith Pelikaan, who are accompanying me in this project and will tell something about the project and how it goes in the Netherlands. Thank you.
Thank you, Walter. And maybe Judith, you can say a quick hello so people will know who you are and see your face.
Good morning, everyone. My name is Judith Pelikaan. Like I was introduced a little bit already by Walter Paans, working together with Walter and Maud in this SOOTHE project.
Thank you for that. And Maud, please.
Hi, I'm Maud. I'm part of the Dutch team for Work Package 2, and I'm a nurse for people with profound intellectual and multiple disabilities.
Thank you. And there were two people who I failed to put on this screen, and I apologize to them, but their pictures arrive later on in this presentation. Pablo Alvarez. Pablo, would you like to say hello?
Sure. Thanks for introducing me, Fintan. So my name is Pablo Alvarez, and I work for Learnovate Center at Trinity College Dublin. And I am the tech lead at the center, and I work as a technology consultant for SOOTHE package, Work Package 2 and 3.
Thank you. And finally, Frank, if you'd like to say a quick hello, and again, apologies for not including you on that screen.
Yeah, no problem. Good morning. Frank O'Reilly is my name. I'm a colleague of Pablo in the Learnovate Centre, Trinity College Dublin. I worked with Pablo and also Sandra and Eddie putting together the workshops and gaining the insights from the participants during Work Package 2 and Work Package 3.
Thank you, Frank. And in the background, we have Michael and Sarah who are providing support, and I'm very grateful to them for that. So I'm conscious of time, so we'll move on to the subject matter of this. What we're going to do is just describe the development of what we see as a unique approach to supporting the viewpoints of people with intellectual disabilities. It's based on that idea that the viewpoints of people with intellectual disabilities often are not heard. And often they do not have the opportunity to have the time to formulate their own perspectives on things. So we've tried to provide time, even though everything was compressed by the pandemic. We've tried to provide time, space, and opportunity for us to hear what people with intellectual disabilities say about mental health and well-being. In order for that to happen, we needed to have a program which was as inclusive as possible, as facilitative as possible, and as flexible as possible. And we are very lucky that we had a flexible program and very flexible teams in Ireland, Netherlands, and Spain, because flexibility is something that we've all had to use this year. So we will present how we approached the rollout of the program, and we'll talk about the possibility of replication at a later stage in this webinar. We will, behind all of this is the reality of the pandemic of COVID-19. So it's very hard not to refer to it at some stage during this webinar. And as I say, we will offer the possibility of collaborating with other sites and countries to replicate SOOTHE here. So Again, I'm going to repeat a few slides from last week. The fundamental part of this is that this activity was about people. It's not about people with intellectual disability, it's about people. It's about people who are citizens of our countries and citizens of Europe. And they have as much right to have the opportunity to speak about and to think about their mental health and well-being as do anybody else who lives in our countries or in Europe. So this is about people. It's about returning people from what often have been the margins to the central point where discussions take place. I'm reminded of O'Brien and Tyne's 5 key service accomplishments, and one of them is real community presence. This activity is about achieving real community presence, people being in the place where real discussions take place. And we brought together partners from 3 countries in this project. In Netherlands, we have partners from the University Medical Center Groningen, and also from Hansa University of Applied Sciences in Groningen. And through our colleagues in Hansa in particular, we have been able to reach out to people with intellectual disability who live in Netherlands and in that region of northern Netherlands. In Spain, we have had the joy of working also with our colleagues in the Parc Sanitary Saint Juan de Dieu. And those of us who are in Ireland, for example, will know that Saint Juan de Dieu is in our country, St. John of God. And St. John of God have been one of the central service providers for people with intellectual disability and people with mental health challenges in Ireland throughout the last many decades. So we're very, very happy to work with them. And in Ireland, we've worked with our very close colleagues, not only our colleagues in Trinity College, where I'm based, but also our colleagues in the Daughters of Charity service. And the Daughters of Charity service is the alma mater for me, because I'm a trained nurse in intellectual disabilities, and I trained with the Daughters of Charity. So we've had a lot of very rich experiences building a very good relationship with that service. So we've been very happy to work with really positive partners and really understanding partners in this regard. What we're trying to address in this project is issues not related particularly to psychiatric or mental health, mental illness. So we're not looking at the diagnosed issues, which at that stage fall within the remit of mental health services, psychiatrists, psychologists, nurses, etc. We're looking at the everyday stresses and pressures that people experience in their lives. And some of these are low mood, anxiety, general stress, but they can become problems which need interventions. And as the problems become more embedded and become, so people start developing symptoms of anxiety and embedded issues of obsessive compulsive issues and so on, depressed mood or mood issues, we need increased resources. So our intention is to try and address everyday stresses with the hope that we can reduce the need for further interventions for people, or reduce it down so that people are able to talk about their mental health and wellness. And through that engagement with other people, it may help them to find coping mechanisms so that these do not become embedded problems. Management of mental health issues across any of our countries is expensive. And as those issues become more significant, the expense becomes more significant. And from a service provision point of view and from a state provision point of view, there is an interest in how can we better use our funding resources to provide for the positive things in people's lives. And so we try to avoid certain problems occurring by putting our resources into the preventative area rather than trying to treat things as they develop later on. So our hope is to reduce the need for those very expensive supports as mental health symptoms start to develop and become more embedded in people's lives, and to try and address things at an earlier stage. And the way we want to address those things is through engagement. It's very simple. It's really very simple. Spending time with people, listening listening for the voice that people with intellectual disability have, but encouraging that voice to come out to express the fears, the happiness, and the ideas that they have, so that we can co-create solutions and innovations to improve mental health and well-being. And those solutions and innovations are not our solutions and innovations. Many people, including ourselves and people with intellectual disability, have solutions in their lives which they do. It may mean going away from people for a period of time. It may be finding a place where you can be by yourself. People have solutions. It may be listening to music. It may be going for a walk. How can we build around those solutions so that they become things that people can control more independently in their lives, and which they could, and then in doing that, the locus of control becomes, for mental health and wellness, becomes something that's within the person. And that is in tune with what we call the recovery model of mental health. So the background to the SOOTHE project is what I've just spoken about, but this is the structure of the project. And it has a number of work packages, and those work packages include a replicable program, a program which is really easy to run in any location, any site, any country. It involves, from the outset, the expansion of our reach to bring people's images in, so that we can bring those images of mental health and wellness together in what we call an electronic patchwork quilt, an eQuilt. And so we bring the voices of many people, which is empowering, and which also gives an opportunity for people to speak and to talk about mental health and wellness in their own local situations. And then we bring groups of people together in work package 2 and 3 to talk about their understandings of mental health. So to voice what their understandings are, and to start innovating. And today we're going to look at the approaches we use to do that. And our hope is through webinars like this, and through reports that we will write afterwards, and through our engagement with other people, that we will be able to disseminate that information. So the program is disseminated, and then if people replicate this program, we want to hear about that. And we want to continue to be developing this program so that it becomes better and more responsive to people's needs. Last week, we launched the eQuilt of Mental Health and Wellbeing, and I really encourage you to go to the SOOTHE website. It's www.sootheid.eu, SOOTHEID.eu, and we can put that into the chat. And to look there, and you'll see a presentation. The webinar of last week is there, but there's also a slideshow which provides an insight into all the images that were received. That is a live eQuilt. We're still accepting images, and I'll tell you about that later. But the focus of today is on work package 2 and 3, and I'm going to stop sharing my screen now, and I'm going to ask Sandra to take over at this point and to bring us through the next part of the discussion. So thank you, Sandra.
Thanks very much, Fintan. So what we're actually going to have a look at now is the experience across the 3 different sites. So first of all, we're actually going to talk about the rollout of work package 2 and 3. And I'm going to ask our Spanish partners, Jose and Desiree, to speak about their experience. Then Judith and Maud will look at the experience from the Netherlands, and then I will come back in then and talk about the Irish experience. So Desiree, if you'd like to chat to us about your experience, please.
Sí, hola, buenos días de nuevo. Ahora vamos a compartir nuestro PowerPoint. Como nos han dicho nuestros compañeros, en la anterior sesión explicamos por parte de Carlos Peña y José Durán lo que fue el Workpage 1, donde se hizo un collage de imágenes a través de la simbolización de lo que era la salud mental por parte de las personas con discapacidad intelectual. Y en esta sesión de hoy vamos a explicar el desarrollo y en sí los resultados de Workpage 2 y del 3. Por mi parte, haré explicar los resultados del 2 y por parte de José Durán el Workpage 3. Bien, pues el Workpage 2 en sí, la idea principal era hacer el entendimiento qué era la salud mental, ¿no?, por parte de las personas con discapacidad intelectual. Esta segunda, el Workpage 2, la realizamos en 3 sesiones. a través de un grupo de 10 personas con discapacidad intelectual, todos residentes de la Residencia Santa Ana de San Juan de Dios. Utilizamos una técnica metodológica cualitativa llamada Focus Group con el fin de crear un debate, un conjunto, ¿no? Un compartir esas opiniones, esas experiencias, especialmente en el ámbito, ¿no? Y en relación a la salud mental. Estas 3 sesiones las realizamos durante el mes de julio, en la etapa del post-confinamiento, en 3 semanas consecutivas. Cada una de ellas duró 1 hora y media. Y sí que las realizamos intentando con un mínimo de organización, pues realizarlas en la misma sala, en el mismo horario, para también el correcto entendimiento de todos. La moderación la realizamos por parte de José Durán y yo, a través de un estilo de moderación semidirectivo, es decir, que sí que nos basamos en un guión, pero a la vez dejamos una libertad de poder expresar aquellas necesidades que tuvieran las personas. Más allá de esto, en cada una de las sesiones sí que destacamos ciertas normativas, ciertos ejes principales para el correcto funcionamiento de cada una de las sesiones. Como normativas, pues dijimos, ¿no? El respetar las voces entre los compañeros, el levantar la mano cuando cada uno quisiera hablar, pero especialmente remarcamos el no haber opiniones incorrectas ni correctas, ¿no? Sino era el hecho del tener un espacio cómodo donde cada uno pudiera expresar todo aquello que sintiera y quisiera, ¿no? Era un espacio totalmente voluntario, obviamente dejábamos que las personas, aquellas que no se incomodasen en hablar de salud mental o de otros aspectos, pues no hablasen o incluso podían salir de la sesión. Bien, pues vamos a hablar ahora de lo que fueron los resultados de la primera sesión del Workpage 2. En esta primera sesión, la idea principal que quisimos era que las propias personas con discapacidad pudieran describir y poner palabras a lo que era la salud mental y el bienestar. Se pudieron distinguir en relación a la salud mental, lo relacionaban mucho con enfermedad mental, con cronicidad, con la presa, la toma de medicación o la necesidad de ir, ¿no? Y hacer una atención médica, especialmente con psiquiatra y psicólogo. Es decir, lo relacionaban principalmente con factores biológicos. Y en cambio, lo que es el bienestar, sí que llegaron a explicarlo como en aquel conjunto de actividades o de hábitos saludables que hacían estar bien a uno mismo y estar bien también con los demás, ¿no? Actividades ya sean físicas, especialmente como el pasear, el dar una vuelta, el pasear especialmente fuera de la residencia, o sociales, el estar bien con los compañeros, el tener el contacto con las familias y el tener el apoyo de los profesionales, ¿no? Bien, sí que aquí destacar que otro de los aspectos de interés personal también muy importantes para el bienestar dijeron que era el escuchar música, ¿eh? El escuchar música para ellos era fundamental para estar tranquilos, para conciliar el sueño. Vale, vamos a pasar a lo que es la segunda sesión del Workpage 2. En esta la idea principal era comprender, dar un paso ya más allá de lo que era la salud mental, ¿no? Era comprender la mala salud mental y el mal bienestar, por decirlo de alguna manera. Se pudo profundizar entonces en lo que era la salud mental, también gracias a alguna técnica de fomento de participación que posteriormente las diremos, y los resultados que obtuvimos fueron que la salud mental la relacionaban principalmente con estados anímicos negativos, es decir, principalmente con la tristeza, con la estrés, ansiedad y con la soledad. Todas estas emociones las dieron a ver a través de sus experiencias personales, experiencias que para ellos eran muy significativas y las relacionaban con la salud mental. Por ejemplo, ¿no? La pérdida de un ser querido, el fin de sus etapas laborales, ¿no? Que algunas de ellas personas habían trabajado durante años en centros ocupacionales o en centros especiales de trabajo, y para ellos el fin de esta etapa laboral había sido muy significante para sus vidas y para su salud mental. Otro aspecto importante que relacionaban con la mala salud mental y que tiene que ver con la situación actual es las consecuencias de las restricciones del COVID. Ellos lo relacionaban con la tristeza, el estrés, principalmente de no poder estar en contacto directo con los familiares, de no poderles ver, ¿no? Ni hablar con ellos en persona, o el no poder salir de la residencia a un espacio abierto, el no poder mantener esa rutina que tenían durante el día a día, ¿no? En espacios comunitarios. Estos sí han sido para ellos situaciones de gran impacto en su salud mental. Sí que cabe destacar que todas esas experiencias negativas que explicaron las relacionaban mucho con el pasado, antes de entrar en la residencia a vivir, ¿no? Había como un antes y un después de estar residiendo aquí en Santa Ana. Y por último, en la última sesión del Workpage 2, la idea era hacer una recopilación de cuáles eran aquellos factores positivos y negativos que influían en la salud mental y en el bienestar de cada uno de ellos, se podría decir. Para el correcto entendimiento de todos, realizamos un póster muy visual con la diferenciación de cada uno de los factores. Como factores positivos, destacaron principalmente los sociales, el estar en contacto con familias, el tener el apoyo de los profesionales, también aspectos físicos, es decir, el mantener una actividad, un deporte, mantener unos hábitos saludables, el comer bien, el dormir unas horas recomendadas. Y obviamente también estados, como factores positivos decían, estados emocionales de motivación, de ganas de hacer actividades. Y otro muy importante era el uso de la tecnología. Esto lo relacionaban como a día de hoy es un eje clave, un factor muy positivo para la continuidad de mantener una conversación, un contacto a través de, aunque sea de una pantalla, ¿no? A través de las tablets con sus familias. Como factores negativos de la salud mental y del bienestar destacaron, pues, por ejemplo, el no tener estos hábitos saludables de vida, una mala alimentación, una alimentación no equilibrada, o también, ¿no?, situaciones externas que podían influir en su salud mental. Bien, voy a hacer una breve síntesis de lo que he dicho en inglés para el entendimiento de todos. Now I'm changing to English to make a summary of this part. Through the 3 sessions of Workpage 2, it has been possible to analyze the evolution of the group in terms of learning of open-mindedness. At the beginning, there was a lack of knowledge and negative vision of mental health. Participants avoided sharing their personal experiences. But with the time and course of sessions, they finished distinguishing all these personal, psychological, emotional, and social factors or dimensions that affect our mental health. And they were able to explain their experiences about mental health, get attention to the others, and be applauded by the group. Many of these experiences were related to those difficult situations they had prior to entering to live together in the residential environment. For example, the end of their work stage or the loss of a beloved one. Finally, I want to highlight the use of technology, especially tablets, as a common positive strategy to alleviate the current social and emotional needs produced by COVID. That's all.
Para el Workpage 3, que en sí lo que buscaba eran las soluciones a esas problemáticas que se habían detectado en el segundo, bueno, tuvimos que adaptarnos un poco debido a la segunda ola que provocó el confinamiento por el COVID-19. Entonces, trabajamos con los mismos 10 participantes, pero tuvimos que separarlos en 2 grupos de 5, lo que hizo que de 2 sesiones que íbamos a hacer, pues se transformasen en 4, 2 para cada grupo. La técnica usada pues siguió siendo el grupo focal. El setting, el lugar donde realizamos las reuniones con los participantes fue el mismo módulo, misma hora, misma duración. Cambió la frecuencia y cambió que nosotros no estábamos presenciales, que simplemente nosotros pues lo hacíamos a través de tablet y hacíamos con el Zoom. En la primera sesión lo que buscábamos era sobre todo conocer las necesidades que ellos habían detectado y cómo las solucionarían. A través de un debate, igual que en el Workpage 2, y los resultados pues, fueron falta de material digital, de dispositivos digitales. No todos tenían ni teléfono propio ni una tablet propia, con lo cual tenían que estar siempre a dispensas de lo que le pudiesen ofrecer en la residencia. La importancia que tiene el contacto con los familiares y con los profesionales y que en momentos era de gran importancia, ¿no? Que a pesar de que pudieran contactar con nosotros a través de un dispositivo digital, no era suficiente en algunos momentos. La falta que ellos mismos detectaban de conocimiento de cómo se usan estos dispositivos, ¿no? Que no todos eran capaces de hacerlo solo y que a veces necesitaban que algún profesional o alguna persona les ayudase. Y bueno, un poco ya lo que había reflejado el Workpage 2, que las áreas que más les interesan a la hora de estar bien, pues la música, la relajación, la actividad física, las relaciones interpersonales y con profesionales. En la segunda sesión hicimos una sesión un poco más práctica. Quisimos experimentar con alguna de esas soluciones que ellos habían propuesto. En este caso fue hacer una sesión de mindfulness a través de videollamada y de esa manera recoger un poco las inquietudes que ellos percibían de este tipo de trabajo, ¿no? De ese trabajo en el cual el profesional está a distancia, no está en la misma sala y los problemas que con ello llevaba, ¿no? El resultado, pues bueno, como estaba claro, preferían que fuese todo presencial, pero veían de gran utilidad este formato de trabajo para momentos muy concretos. La verdad es que siguieron la dinámica, a pesar de que las interferencias ambientales se escapaban a nuestro manejo, ¿no? Pues gente que entraba o salía en la sala, luces que se encendían sin querer, ruidos, todo eso, pues quieras o no, eran unos... hacían difícil que pudieran seguir y a pesar de ello, yo creo que las ganas que tenían de participar hicieron que funcionase muy bien. Y en sí valoraron la experiencia como positiva, afirmando que sí, que sería muy útil al día a día, pero no como algo solo, sino que necesitarían de alguien para poder operar con la tablet y poder realizar esas diferencias. No haré la síntesis porque creo que vamos mal de tiempo, con lo cual ya dejo que Sandra, it's time for you.
Thank you very much. So I'll ask Judith and Maud to tell us about their experience from the Netherlands, please.
Thank you, Sandra, for giving us the word. As from the Netherlands, we were working in a team to work on the defining on mental health and well-being. And actually, we were very motivated to start with the project, because this was really the project to really give the voice to the target group, the group of the group of the intellectual disabled people. But we came across quite some challenges, and I don't want to be negative in this story, but it is good because we learned a lot about it to explain a little bit of those challenges during this process. First of all, or actually everything had to do with accessibility. And although at the end we succeeded to do some pilot interviews, we didn't succeed to do a proper interview to really come up with results for the project. But I think it is good to share some of our experience, because it says something about organization, about culture, and about the target group itself. And it all had to do with accessibility. First of all, we had some difficulties from out of the university to access the target group. For accessing the target group, you of course need a good network. You have to be connected with the professional field, and you need a good contact, especially in, and I don't think it needs very much explanation in COVID times. And we came across that it was in these stressy moments, stressy periods, quite hard to come from out of the university looking for research possibilities into the professional field. So that was the first thing we came across, what gave us some difficulties, because the institutions were quite closed during this period of COVID. The second level of possibilities, or actually difficulties in terms of accessibility, were that we needed caregivers to help us to connect the target group with the researchers, with the interviewers, and at this moment it was hard to be connected with them, and also to ask them to be involved and to help to help with conducting the interviews. And then the third level of accessibility was the target group themselves. During the pandemic, it was not possible to create groups of 10 or people with an intellectual disability. We decided, being flexible, to do them individual. And because of that was quite difficult, we tried to do that online. But then we found out, and Maud will explain it a little bit more, that talking to a computer without any really involvement of caregivers or other helpers was quite a challenge as well. well, we were happy as well that Maud was involved because she has a good access to institutions where people with an intellectual disability are living. And probably, Maud, you will explain a little bit about your experience about and what is the situation, well, the actual situation where you are in now.
Yeah, well, one of the main barriers was that I could not conduct the interviews in my own work environment. So I had to rely on Hanse to provide service users and people I could conduct the interviews with. And yeah, what Judith also said is that the people they found were quite, yeah, adults, but at the end of it, like 65. So they did not have any own communication skills towards technology, and the care staff did not have time, and yeah, really did not have time to conduct all those interviews and stay next to them. And they also explained that because of the COVID and day activity centers and workplaces were temporarily closed, like their safe environment was gone, why they would not feel safe to also talk to a stranger about mental health and well-being. I think those are the most main concerns. And that when we found different participants for the interviews, I had to stop the project because I'm a nurse and I work at a place, and we had a COVID outbreak, so I could no longer conduct the interviews.
Maybe, Maud, well, there are two other things we wanted to stress in this webinar. And we also find out, and I think that's a very interesting thing, that well-being and mental health, even in our pilot interviews, we found out that it is in an individual level quite complicated to express. It is still a very verbal focus, so we were also looking to other ways of expressing well, the mental health and the well-being. So looking for other forums to be really engaged. That was what Fintan mentioned before as well, to engage with people so they could express their well-being and their mental health. We found as well that we were blocked in the possibilities to really be engaged with the target group and find out what really for them felt mental health and what was well-being for them. When we were preparing this webinar, I think Maud mentioned something about the actual situation, what was really coming to the bottom of well-beings, and it's something about the actual situation. So maybe you will explain that a little bit, Maud, as a conclusion, or as at least the end of this contribution of the Netherlands.
Well, I think a lot of the well-being has to do with day structure, and because of closing of day activity centers and a lot of new care staff during this time, it's not very great for mental health. And doing the things you normally do that gives you structure and give you like happiness, and you rely, a lot of the service users really rely on care staff, and when care staff like get sick, has to work in other places, you get new care staff that don't know what your health and mental health and well-being is and how you get your guidance, that it gets really hard. Yeah.
Okay.
Thank you.
Thank you. Thank you so much, Sandra. This was the contribution of the Netherlands for so far.
Okay, thank you very much, Judith and Maud. And it's interesting, there's a lot of similarities across our three areas. So things around access, and again about services, day services being closed and the impact that may have on people. So I'm just going to have a look at it from the Irish perspective. So hope to be able to share my screen. So I suppose what we initially we had applied for ethical approval from Trinity College and from the Daughters of Charity, and we had been successful in getting ethical approval to conduct the project. And then we were faced, and initially we had planned that we would have face-to-face focus groups, and we would invite people from the service into the Trinity College campus, and so that we would have it as you know, our group focus groups and be able to engage face-to-face with people. But then due to COVID-19, then there was public health restrictions. So we found then that we weren't actually going to be able to meet up with the participants. And so we had to move to thinking about how we were actually going to conduct our interviews virtually. And it was decided then that we would do it via Zoom. And again, so what we had to do was then to go back and get ethical approval from both sites to make the change, so that we could access our data collection had changed. And so we were successful in both of those applications. But again, what we found is, and Frank will talk about this a little bit later on, is that we had again thought that we would actually be able to bring people together in the service, and that we would be communicating with them virtually. But because of the way that the COVID-19, the pandemic panned out, people were not able to congregate. So what we found then was that we were conducting the focus group interviews with individuals in their own individual homes, as opposed to coming together. So we had a lot of support, both here in our own team, but also in the service. So last week you would have met Dr. Neve, and she's the clinical director at the Daughter of Charities Disability Services. And she made arrangements locally to have an RNID on site, whose role was to coordinate the individual support that participants would require so that they could participate in our meetings. And that support ranged from somebody being there to help somebody to actually connect to the Zoom meeting, maybe turn on or focus their camera, or turn on or off their mute button, to maybe somebody having requiring a key worker throughout the whole workshop to support the individual, either through maybe clarifying questions that were being asked, or maybe explaining or clarifying what the individual had said. So we had 4 main facilitators that were conducting the workshops, Frank and Pablo from the Learnovate team, and myself and Eddie from the School of Nursing. And we worked extremely closely together throughout the whole process. And while we were the 4 main facilitators, we do acknowledge that we had full support of our teams behind us. So, but we just happened to be the 4 key people. In preparation for each of the workshops, we had to, we met virtually, and we went through our interview guides. We discussed and agreed the content and the format of the workshops. And following this, Frank and Pablo prepared virtual whiteboards. And again, Frank will refer to this later. And this was actually a fantastic tool that they used to help us to document what was being said in the workshops. And Eddie then was the lead for Work Package 2. And he linked with the site coordinator via email prior to each of the workshops, providing the details of the forthcoming workshops and providing all the Zoom details. And again, this had all the Zoom details had been provided by our Learnovate team. And we also sent an individual email to each of the participants outlining all of the information for the workshops. Similar to our Spanish colleagues, we felt that it was very important to have consistency throughout the whole process. So each workshop commenced at the same time. That was from 10:30 until 12. And again, you know, we were looking at how are we going to engage with the individuals when they didn't know us and we didn't have that face-to-face contact. So we started all of our interviews workshops with an icebreaker activity. And Eddie was the main interviewer, and so for consistency he led all of the interviews, and my role then was to be sort of co-interviewer in terms of asking probing questions and taking notes. And then behind the scenes, then we had Frank and Pablo, who managed all of the technical issues prior to, during, and after each workshop. And then they led out on the interview, the 5th and the 6th interview, because that was when we were really exploring the technical interventions. At strategic points then throughout the workshops, what we found was then that Frank and Pablo would share the mirror boards with us, and what we used that was an opportunity to recap what we had discussed in each of the sections, and to give the participants an opportunity to I suppose add anything that they wanted to do. I should have said that we had 7 participants who were involved in this, and then after the workshops then we took the opportunity to discuss the key issues that had emerged, and we agreed how we were going to progress to the next workshop. So say we worked extremely closely. So now what I'm going to do, I say if anybody has any questions, just please do put them into the chat function. And maybe what we look at now would be go back to our Spanish colleagues, Jose and Desiree. I'm going to ask them to talk about the experiences and the challenges that they had. So thank you.
Hola de nuevo. A continuación vamos a explicar por parte de aquí de Sant Joan de Déu, el Parc Sanitari Sant Joan de Déu, cómo ha sido la participación general de las 10 personas que han participado en los focus group, tanto del Workpage 2 como del Workpage 3. En sí la participación cabe destacar que hubo un gran incremento especialmente entre la primera y la segunda sesión del Workpage 2. Esto viene dado también, dado que al inicio había cierto rechazo, cierto miedo y temor a explicar lo que era la salud mental, ¿no? Dado que lo relacionaban mucho con pues, el trastorno mental, dificultades que ellos no querían expresar, no se veían en el momento de compartirlo. Así que a medida de las diferentes sesiones fueron llevando a relacionarlo con el bienestar, con otros factores, es decir, con otros factores ya sean sociales, externos o biológicos, ¿no? Es decir, o personales, ¿no? Y emocionales que también inciden en ella. Esto les hizo una amplitud de miradas en lo que respecta a la salud mental y a la vez fomentó el participar y el poder expresar las propias experiencias en relación a la salud mental. Bien más allá de ser algo personal, algo de experiencias muy íntimas, algo de ser común la salud mental en todos, ¿no? Además utilizamos diferentes técnicas de fomento de participación que les ayudó a expresar las propias emociones y experiencias relacionadas con la salud mental. Una técnica, por ejemplo, es la visualización de escenas de películas, sea por ejemplo de apoyo mutuo para la superación o de aceptación de la enfermedad, ¿no? A través de esa visualización de escenas, las propias personas se vieron identificadas en esas escenas y quisieron compartir sus experiencias. De hecho, ¿no? Hubo ese cambio de no querer compartir a compartir, ser escuchadas por los compañeros y a la vez ser aplaudidas. Como limitaciones en la participación, sí que vimos, ¿no? Además de ese rechazo inicial y el desconocimiento de qué era la salud mental, más allá de esa cronicidad y enfermedad mental, sí que había la necesidad de reconducir la dinamización del grupo, ¿no? Habían ciertas personas o que tendían bien a evitar compartir, evitar hablar, o algunas que de hecho querían hablar de otros aspectos que no tenían a ver con el tema de debate, ¿no? Entonces sí que por parte de José y mía, los moderadores, pues intentamos siempre limitar y un poco reorientar el tema que queríamos un poco a debatir. Y como resultados finales fue este aumento de participación en función también del aumento de la confianza del grupo y algo muy común en todos también el superar esas experiencias de temor y en el hecho de querer hablar y de querer y las técnicas, ¿no? El uso de estas técnicas que ayudarán muchísimo. Voy a hacer esta breve síntesis en inglés para el entendimiento de todos. Now I'm changing to English to make a summary of this part. In the work page 2, one of the most important aspects is the increase of the participation, especially between the first and the second session. Mainly in the second session, they started feeling more comfortable discussing about mental health. Techniques were really helpful. For example, when watching the movie Stands about social discrimination or acceptance of illness, they felt identified with the characters, and this helped a lot of encourage them to share similar experiences. Ahora mi compañero José explicará lo que es la participación en función del workpage 2. No sé si José.
Aquí deciré. En la tercera parte, pues como ya hemos comentado, que lo que buscaba eran esas soluciones, esa innovación, ¿qué nos encontramos? Pues nos encontramos de nuevo una gran participación, hasta el punto en el que, bueno, cuando nos veían por los pasillos o nos veían haciendo algunas otras tareas, los participantes nos paraban y, oye, ¿cuándo vamos a volver? Que tenemos muchas ganas, Con lo cual, eso generaba una sensación de satisfacción por mi parte y por la de Desiré, porque quiere decir que el trabajo estaba siendo provechoso. De nuevo, el aumento de la confianza del grupo. El grupo se sentía muy bien explicando cosas que a veces ni tenían nada que ver con el proyecto, porque, bueno, tanto Desiré como yo no somos profesionales que estemos habitualmente con ellos, somos de otras unidades. Y la verdad es que era muy divertido ver, ¿no?, esa confianza para explicarnos pues, qué querían pedir para los Reyes Magos, bueno, para la Navidad. Era divertido. Luego las soluciones estaban muy enfocadas a eso, ¿no?, a ese bienestar emocional, ese bienestar social, el poder reencontrarse con los suyos. Un poco, a fin de cuentas, volvíamos a estar en época de segundo confinamiento por el COVID, y esos temores y esas ansiedades por sentirse cerca de la familia, pues volvían a resurgir. Salió que la tecnología como base de una nueva forma de cuidar, como algo importante que añadir a todo lo que ya hacemos y todo lo que se va haciendo. Luego la técnica que hicimos en la segunda sesión del Workpage 3, de la sesión de Mindfulness, mejoró el estado de ánimo de 8 de los 10 participantes. Hicimos, al finalizar la sesión, hicimos un poquito de escala de satisfacción para ver cómo les había ido. Y 6 de 10 expresaron que la técnica de relajación en línea sí que la usarían en caso de sentir ansiedad en algún momento, que es algo que nos parece importante. Después, las complicaciones, pues de nuevo un poco el tema del respeto del tiempo de palabra. En este caso, al estar nosotros en otra sala haciéndolo de manera telemática, pues costaba mucho controlar esos pequeños detalles. De nuevo, la falta de control y la interferencia ambiental, esas luces, gente que pasaba. Necesidad de que estuviesen acompañados. Tuvo que nuevo estar una compañera nuestra, una integradora social, realizando el apoyo, porque si no hubiese sido bastante complicado que ellos hubiesen prestado atención a todo lo que hacíamos, y Desiré, que fue quien llevó la sesión y que lo hizo muy bien, pudiese conectar con los chicos. Y una conexión débil. Sí que es verdad que en este momento en el parque no tenemos una conexión wifi espléndida que nos generase que no hubiese problemas, ¿no? Había momentos en que la videollamada pues, se caía, no se escuchaba bien. Hubo algunas pequeñas dificultades. Sobre los resultados, bueno, aceptar las actividades digitales como una herramienta complementaria al resto de la terapia, no como algo en lo que solo puedan basar, sino ellos necesitan, por lo que ya hemos dicho muchas veces hoy, ese contacto directo con el profesional, con cualquier tipo de profesionales. Una gran necesidad de formación y de adaptabilidad del mundo tecnológico a sus necesidades. Eso fue algo que ellos mismos declararon, de que no se veían capaces de utilizar ellos la tablet y conseguir contactar pues, con cualquiera de nosotros para realizar algún tipo de actividad o de ejercicio, si no fuese acompañado de otro profesional, ¿no?, que les ayudase un poco a manejarse. Y luego algo que todos consideraron también importante, que era un espacio óptimo para ello, ya sean salas que estén habilitadas solo para realizar este tipo de actividad, en las que no hayan esas interferencias ambientales que comentábamos, que tengan una gran conectividad a Internet para que no haya problemas y las frustraciones que eso puede crear en el usuario, en el participante, en este caso, a la hora de contactar con nosotros. y eso es un poco todo lo que visualizamos. De nuevo, muchas gracias a todos y las preguntas que van surgiendo, que ya os han comentado Fintan al principio, que las vais marcando en la sección de preguntas y respuestas, las contestaremos al final, ¿de acuerdo? Thank you, Sandra.
So again, we've a lot of similarities in terms of the challenges, but I think that from the onset, the developing rapport and trust with the participants was something that was extremely important for us. And it wasn't without its challenges, because again, we had originally anticipated that we would be able to come together face to face, and that wasn't possible. And also too, the fact that the participants were in their own individual homes, so even they weren't able to come together as a group. So we worked very hard on participant engagement, and hearing the voice of all participants was something that was really very important for the 4 key facilitators right throughout this process. So we made sure that at each stage we called the person by their name, and we asked them for their contribution, and that was very, very important. Also to our preparation for the workshops, in terms of, we spent a lot of time going through our interview guides and discussing how would be the best way to ask the question. And while Eddie and myself were the main facilitators in workshop 1 to 4, Pablo and Frank were in the background, and they would actually use the chat function to actually suggest things to us and ask us maybe were areas that we needed to probe. And that was extremely important for us. We did find that at times participants weren't able to join the workshop through no fault of their own, particularly maybe in relation to technical issues, where maybe somebody's connectivity was low, and on 2 occasions the actual internet provider was down, so people couldn't participate. And while we were a little bit concerned about maybe having maybe a smaller number of participants, it actually proved extremely beneficial to us, because, and particularly, Pablo and Frank will talk about this in the next webinar, particularly around when they were presenting their ideations and the protocols, to be able to tease out an awful lot more with a small group of people was important. Again, the biggest, the time scale, we had originally thought that these workshops would happen every 3 weeks, and then we couldn't get access to services because of the pandemic. And then what we found was, when we did get access, with the time scale of the study, so we were actually doing the interviews every week. And while that was okay for the first few, it actually put, the tremendous, I suppose, pressure that was on our Learnovate colleagues in trying to develop prototypes in such a short period of time, and they did come up with 3 prototypes, which is an absolute credit to people to be able to put together such fantastic prototypes in such a short space of time. So I think that for us, it was a very, very positive experience for the participants. They looked forward to joining us, and at the end of every meeting, they'd ask us, when is the next workshop, what time is it, and who are we going to meet, and so on. So again, while we had challenges, I think that we overcame them very well. And again, the support that we got back in the Daughters of Charity to support the participants is also something that we really welcomed. So thanks very much for that. Now I'm going to hand you over to Frank. And Frank is actually going to talk about the virtual meetings. So Frank.
Can you see my screen?
Yes.
Yeah, hi. Yeah, I'm going to talk about supporting the virtual workshops. And I'm specifically going to talk about Work Package 2, so that the first 3 workshops, and we'll talk about Work Package 3 at next week's webinar. Now, I'm just going to give an overview today, and if anybody needs any more details, please feel free to get in touch with us, and we can provide with more details. And what I'm going to talk about is our approach to the workshops, before the workshops, during the workshops, and also after the workshops. So basically, as Sandra and the other participants were saying, right at the start, we faced a significant challenge with moving from face-to-face to online for these workshops, because the original plan was to bring all the participants and the investigators into the one room and conduct the workshops face-to-face. Then, you know, with the initial period of COVID-19, we had an idea of at least grouping the participants in a facility together, and then the two facilitators, Sandra and Eddie, the two investigators, could use Zoom or some kind of video conferencing to interact with them. But even that proved to be very difficult, because in the end, what happened was that all the participants were in individual settings, and we had to take into account how we were going to manage that and make that work. So basically, as Sandra was saying, myself, Pablo, Sandra, and Eddie worked really closely to prepare the workshops as best we could. And from our discussions, what came out of that was that there were certain requirements from the participants that we needed to look at. So what we did was we put together an information sheet that we could send to the Daughters of Charity, who were the partners helping provide the participants. And that information sheet allowed us to collect information about where the participant would be connecting from, what technology they would be using, what help they would need, and what they could and couldn't do. So that gave us a great picture of what we needed to put in place to make the workshops work online. One of the things that came out of that, there were a number of things, but one of the key things that came out of that was that we put together a Zoom Easy Reader that could be sent to the participants, so that either they or with the help of a carer or key worker could install the Zoom application and get themselves up and running for the workshops. We also had requirements from the investigators from Sandra and Eddie's side, because they prepared their interview guide, which laid out the structure that they wanted to use to run the workshops, and also the topics and questions within those topics that they wanted to use. So myself and Pablo, working with Sandra and Eddie, decided to use a Miro online whiteboarding tool, and I'll come back to that in a moment to explain how that worked in the concretely in the workshops. So that was the preparation before the workshops. So during the workshops, these were basically the technical tools we were using. As I said, we were using Zoom for video conferencing and screen sharing. More specifically, the chat function within Zoom we were using to communicate between the Learnovate team, myself and Pablo, to communicate directly with Sandra and Eddie during the workshops if we needed to tell them something or ask them a question. Also, as Sandra said, we went around each participant one by one, and we used the Zoom Spotlight function to make sure that the person speaking was seen by all the participants, and that really helped facilitate participation and understanding. As I said, myself and Pablo were working offline ourselves on the Miro board that we would then share periodically during the workshops to go back through the contributions of each participant. And myself and Pablo also had a Slack communication channel open so that we could communicate privately between ourselves if we needed to talk about how the workshop was going. So just to give an overall picture of what that looked like, as I said, the Learnovate team of myself and Pablo were communicating with Slack, and we were using, Zoom and Miro and the Zoom chat to either communicate with the investigators or to share the Miro screen with participants as we went through the different stages of the workshop. Very quickly, I'll give an overview of the process that we used during the workshop. So as Sandra said, having discussed how we would run them, it was very important that we began each workshop with an icebreaker where people could just reintroduce themselves or talk about how they were feeling on that particular day. Once we'd done that, we then went into each topic, and a topic in the workshops would be, for example, physical and emotional well-being. And then we'd pose questions around that topic to each of the participants, highlighting each participant as they were contributing. And the Learnovate team, myself and Pablo, were then in the background recording this onto a Miro board. And then once all the participants had contributed, because as Sandra and Fintan and everyone else have been saying, the inclusivity of these workshops was really important. Once everybody had contributed, we would then share the Miro board to the Zoom screen, and Eddie would go back around each person and walk them through their contribution so they would see exactly what they'd said, and that really helped to reinforce and get a better understanding of people's contribution. And we just repeated that process for each of the different topics during each of the different workshops. And just to give you an idea of the Miro whiteboard, each of the blue squares on this Miro whiteboard represents separate topics within the workshop, and the yellow, the greeny yellow board block in the middle is what we gained from the icebreaker or the introduction section. So just to give you a brief view of what each of those sections of the Miro board look like, this is in the area of when we interrogated or when we talked to the participants about the meaning of mental health. These are the things myself and Pablo were collecting on the Miro whiteboard from each of the participants that we could then share to the Zoom screen and walk through each of the participants with. And as I said, if anybody wants to more details about how we did all of this, please feel free to get in touch with us. So after each workshop, basically, the way we ran it, it meant that we had a number of digital outputs that were immediately available once the workshops were finished. We were able to export the Miro whiteboards as a PDF, which was very useful for Sandra and Eddie to compare with the notes that they'd made and write up reports from each workshop. We also, if needed, we had an audio recording of each workshop. So if there was any questions or any doubts about what was said during one of the workshops, we could go back through the audio recording and verify the contribution. So after each workshop, we would sit down again, the Learnovate team with Sandra and Eddie, and debrief, see how it went, and we'd refine. And this was very important that we were constantly going through a process of reviewing and refining. And that would be one of the key lessons, or one of the first lessons that we learned, was that good preparation, reviewing after each workshop and refining the process. We communicated really, really well as a team. And that drove a continuous improvement as we went through the process. Another lesson learned was in structuring the online workshops to be as inclusive as possible. As I said, we started with an icebreaker. We focused on one topic at a time, and also we focused on one participant at a time, which we thought was very important, and in the end worked very well. Another important theme that ran through the way we approached it was we focused on what the participants were able to do, what they can do, and not necessarily what they can't do. And we'll talk about this again when we come to the solutions next week as part of the third webinar. Because if a participant, and a lot of the participants in the workshops weren't very verbal, but they could sing or they could dance and express themselves differently. And we were able to capture that on the Miro whiteboard and show it back to them during the workshop. And if they couldn't read, well, could we use imagery to convey their feelings and thoughts? Finally, you know, it's something that we're very conscious of in Learnovate. We're a technology center, but we're always trying to make the technology as simple, invisible, and at the same time as clever as possible. Because from our point of view, technology is just the enabler. And what we're always trying to focus on is what we're trying to do. What is the outcome we're looking for, or as a term we often use in Learnovate, what is the job we're trying to do using the technology? So basically, that's an overview. As I said, it's quite a high level view of our approach to the workshops, particularly in running them in a virtual environment. And as I said, if anybody has more questions or would like more details, please feel free to get in touch with us after the webinar. Thank you very much.
One of the things we've seen here is that there's been innovation of many types happening. We've had to innovate in relation to how we how we get access, how we conduct meetings, but also we've had to look at issues in relation to the in relation to the technology that we've used. So we've seen the use of technology as a way of to facilitate interactions which may not be exactly the same as the interactions we would have if we had a proper focus group, but they have provided us and people with intellectual disability with the possibility to engage with each other in very meaningful ways. So we will talk a bit more next week about the issues which arise in relation to in relation to the learning that we've got from this, and we've got some insight into that from our Spanish colleagues in particular. But as we come towards the end here, I wanted to just bring us back to this model, which is the SOOTHE model, and in particular to the replicable program part of it. And as you'll remember from this is what we've tried to build up here is a replicable program which can be taken and copied somewhere else. Now, I know that some questions which were coming in asked about supportive technology, etc. And I think there are things which we need to explore moving forward. We've had the benefit in Ireland of having our colleagues in Learnovate working with us, but we've seen in Spain that where there wasn't a Learnovate group, the people who were working there were able to start advancing into virtual meetings as well. There are challenges, and obviously supports need to be put in place. But we've been lucky enough to be able to learn from some of those here in the Irish situation. We will share that information with people. There's and we will be doing some reports on this as well. But what I want to just bring you to is just to have a look when you get an opportunity at the SOOTHE website. So it's www.sootheid.eu, SOOTHEID.eu. Now, there's a couple of things on that. First of all, when you go, I was hoping to share the actual site with you here, but I'll have to use screenshots. So you'll see that the first page says that the eQuilt was launched on the 4th of December. When you go to the link, when you go further down that page, you'll see flags, the Irish flag, the Dutch flag, the Spanish flag, and a flag representing other countries in the European area who may want to submit images at this stage. That's still open. We haven't closed it. So if people still want to contribute to that quilt, they can still do so. So please have a look at the website there. There are some there's a survey type of approach in there which provides information and ensures that people understand what they're doing when they're contributing. You'll find also on the SOOTHE page that last week's webinar, webinar 1 is there, and in the next few days this webinar, the recording of it will be there as well. And further down the page you can see this SOOTHE slideshow. And the registration link for next week's webinar is there, and I encourage you to come because there's really interesting information coming next week. The other thing which we're building at the moment, and it's functional to a limited degree, is I've put together the model on the website, on the web page there, and if you can click any one of those work packages up to work package 1 to 3 at the moment, and that will bring you to, for example, work package 1 will bring you to information about the quilt and how we approached that. At the moment, the information is limited, but we're building on that, and we expect that will be up and running in a much more a much bigger way and be more interactive by the end of this year. So the first three of those are at the moment linkable, and they bring you to other pages. And we do encourage you to consider conducting the SOOTHE project in your own sites. And it doesn't matter whether it's in a European country or not, it doesn't matter. Our idea is now to expand this as far as possible. The only things that we do ask, and sorry, if you are interested in doing so, please email me. My email address is there. Also, if you've asked questions and if we do not get to answer your question today, please email me the question and I'll make sure that you get an answer. Some things to note: we will offer a certain amount of support and advice in rolling out the project, but in doing so, the payback for us is that we expect to be collaborators in that and to keep, I'm not going to say control, but to keep some oversight over the project as it moves forward. We would always, of course, in any project like this, require full acknowledgement given to the team and the work that we've initiated between ourselves here in the 3 countries. And we'd also ask, because we want this to be a model which will develop as we move forward. We'd hope and expect that the information that you get in terms of the experience of rolling it out, any modifications you've had to do in consultation with us, any learning that you get from it, any other innovations which are learned from your rolling out of it will come back to us as well, so that we'll be able to continually modify and refine. This is not about control. This is about collaboration and trying to build something that builds on what's there, as opposed to going in all different directions. So we would be expecting to maintain oversight of the program's development as it moves forward. So we're really eager to work with people in this regard. I think it's exciting. A lot. It's very. At the end of the day, this is so simple. I mean, that's the thing which strikes me about this. There's nothing particularly difficult in this. Obviously, there are technical issues which will need maybe local solutions. But again, we will talk to you about that and see how we can what might be the solution for you in your situation. And so we're coming to the end of this part, and where we've a few minutes left to look at questions and answers, and I'm going to try and bring in those. Please remember, the next webinar is on Friday the 18th. It's the 3rd and final webinar from the SOOTHE webinars. It's a few days probably before the Christmas break for some of us, and if you celebrate Christmas, that is. And it's going to be important, because there we're going to be hearing from some of the people, again, with intellectual disability, telling us about what they've learned and what it was like for them. So I'm going to stop sharing my screen, and I hope that my camera is working.
Yes.
It is. Great. I
Yep.
can't see myself. So let me just go to some of the questions here, because some of the questions have been coming through, and thank you. Can I just say thank you to everybody for those who've presented today. I think it's been very interesting. Obviously, we want to make sure that our audience, who come from a number of different countries, are able to understand, and so that's why we are moving between, at times, Spanish, English, and Dutch. This is a project, a European project, and it's only right that we recognise and value the various cultures and languages in our region. So I have a few questions here. I suppose there was a comment from, I think it's Tofig Azanud, who's based in Ireland, I think, and said that he identified, when I mentioned about listening to music early on, he identified that playing music and using things like figure notes and other software and apps maybe is another thing which can be used. And he identifies that was researched in Finland in relation to mental health. So again, these are angles and directions which we can explore as we move forward, and maybe explorable as innovations by people. But he also identified that it would be interesting to carry out interviews with families who care for people with intellectual disability. And I think some of those things are starting to happen. His context for that is the fact that so many day centres are closed. And have been closed in some situations for quite a period of time, and that may be contributing to the stress and well-being and mental health of the family members. We're actually carrying out a piece of work at the moment where we're exploring mental health and wellness amongst people who have provided service, professionals providing service to people with intellectual disability during COVID-19. So I think these are important questions to be asked. Martina asked a question about whether the participants already knew each other. Now, I think, and Jose, you might be able to tell us, I think in the Spanish situation that most of the people would have known each other at the time. Is that correct?
Yes, Fintan is the connect with people in la misma residencia. We living in a residence, yeah. And he is companies for the rooms. Yeah.
Okay, so these were people who were living together in a residence. So they would have been living together. I think in the Irish situation, people may or may not have known each other, but when we were interacting with them, they were located separately from each other in some cases in their own houses. Martina, I think, is alluding to the issue that would that have in any way have affected their responses in their mental health. Because of the nature of the stage of this program and the nature of it, that's not something we looked at. And I think also because we had to confine this program from being a 12-month project down to being a 5-month project, we weren't able to achieve everything we might have wanted to achieve out of it. But these are things which we can look at as we move forward. So it's a really interesting question. And Kathleen also identified something. She said that the Spanish study highlighted the effect of past hurt and rejection and discrimination that participants had experienced. And she wondered if these experiences from the past added an extra level of risk for mental health difficulties. I know a lot of the work which I've been doing in the past has been premised on the fact that many people with intellectual disability have experienced negative things in their lives, not because of services, but because of maybe the realities of marginalization, the realities of lack of choice, etc., etc. And we know that that has an effect on people's mental health and well-being. But I don't know if anybody would like to, in the panel, would like to respond to that. So did the historical hurt and rejection that participants experienced have an extra effect on the mental health difficulties that they were experiencing? Does anybody want to speak on that?
Okay, yeah. Their previous experience are indeed a factor of risk. That with these studies complementary of the other treatments of psychology, psychiatrist, and not its unique treatment, okay? And it's important, but it's not the first treatment.
Okay, and thank you, Jose. Sandra, do you want to say anything from the
Yeah,
Irish?
no, that wasn't something that came up for us. I suppose the main thing that came up for us was the impact of COVID-19 and how that was affecting people. So that was their main focus. So we didn't look at any of the historical issues. Yeah.
And I think from the Dutch perspective, the difficulties in access were significant. Yes. There. I think the difficulties in access, whilst we didn't experience the same things here, I think I alluded to this last week. The current situation that many people with intellectual disability find themselves in all of our countries is that they are seen to be a vulnerable group, and so access becomes much more challenging. And I think this is a particular problem that was experienced by Maud and Judith and Walter in Netherlands. We experienced a certain amount of that because for quite a period of time we did not have any access to service because of the concerns that we would introduce COVID-19, or else that the intermovement of people between different houses could be problematic. So I think there are issues there. Hopefully we move, like Tofik said, about places being closed. Hopefully we can move as vaccinations come towards opening up sites again and increasing access, not only of us to people with intellectual disability, but more importantly, people with intellectual disability to society. We probably won't get to all questions. I'll just say, Anya asked a question about whether the excitement of this for people with intellectual disability and the doing of something new had an effect on people's involvement and whether there would be support in an ongoing basis. Our intention is to work with our current partners and to work with other prospective partners who have come to us already to see what we can do to advise, because quite a lot of the supports that have been put in place here are available in one form or other and can be used by people, but there's a certain amount of learning that needs to take place on the part of the people to use things like whiteboards and mirror boards and things like that. But a lot of this technology is usable and available. And sorry to not to pass this on to the other members of the team
okay.
at the moment, but just to, Reinhardt asked, how did we select the participants? Did you use some kind of indicators? The main indicator at this stage were what we just find is older people with intellectual disability. And the target group, so to speak, was people who were over the age of 45, if I could remember correctly. And that age sounds very young to say older, but it is the age that is used in the intellectual disability supplement to the Irish Longitudinal Study on Aging. So these were the main approaches. Supporting participants emotionally during the workshops, John asked. We at all stages there were support people from within the services present, so people were supported as they took part in this, and that was something which was discussed with the services who became involved.
Mm-hmm.
So we for example in the Dose to Charity service we had a clinical nurse specialist in mental health and also the clinical director available to provide support also if that was necessary beyond the normal supports. And finally, Rosemary commented, supporting individuals with their mental health and well-being is a topic of paramount importance and a model to emulate in the future. And I think that's a good place to end this webinar, because we're going to move and see, well, what did that support mean in terms of what people told us? And that's what we're going to be looking at next week. And Michael has, I think, has put a notice into the chat there with the link to the Zoom link for registering for next week. So we hope you'll get involved in that. It's the one, as I said, this is the cliffhanger. We're going to tell you we learned some really interesting things. And of course, any learning from people and listening to people with intellectual disability is always interesting and motivating. And it's also life-changing. So life-changing for us and life-changing for them. So we move to next week where we have the opportunity to hear those. I think that will put us in an energized way, in an energized situation as some of us look forward towards our break over the coming weeks. So again, thank you to all the panelists, all the presenters. Thank you to those who are supporting from behind the scenes, and thank you in particular to those of you who attended today, and those of you who have remained with us. Quite a number have remained with us, right, for 90 minutes. It's a long time for a webinar, but there's so much to tell. Yeah. Thank you so much. Have a nice day, and I hope you have a nice rest of the week and weekend. Thank you.
Thank you. Thanks, Vinton.